wanted to first thank you for inviting me to be the guest speaker for today's presentation. And I'd also like to briefly introduce myself. My name is Elena Borelli, and I am a physician assistant. I've worked in healthcare for just about over 20 years, and I've practiced as a PA for 13 years. In addition, I'm also a board-certified patient advocate, and a few years ago, I opened up my own private patient advocate company. In addition, I recently opened up a telemedicine company, an online urgent care. And so I'm fortunate to really see the healthcare system on both ends, both from the patient side through patient advocacy, and then also as a healthcare provider working in an urgent care setting. So today's topic is going to be about how we get through healthcare in uncertain times. In the light of uncertain events such as COVID-19, how can leaders within healthcare organizations navigate this fog of uncertainty, manage employees and patients' anxiety, and find the opportunities which lie within the challenges? Positioning your organization with success amidst chaos requires maintaining a laser focus for the future and having the confidence and resiliency to sustain and realize that vision. We will discuss the following topics in this webinar today: tactics for leading effectively, ethical considerations, and duty to plan. After this webinar, you should be able to explain optimizing facilities and operations, care delivery best practices, and the path forward. As we watch the unfolding updates on the coronavirus, we're reminded of the turmoil, fears, and stress that comes from uncertainty and the damage that it can cause on morale and productivity. It's the leader's role to bring order to chaos, calm the nerves of those around them, give people hope of successful outcomes, and then get them working towards that successful outcome. Let's walk through a few tips that helps bring order to chaos. We will go through them one by one in the next slides. First is communication. Remaining flexible, being positive, creating small wins, and then focusing on your one true mission. First, let's talk about communication. If you're in a leading position at a medical facility, seek to understand the mindset of your employees. What are they thinking and feeling? And then react with empathy, authenticity, and integrity. Be a good listener. Encourage open conversations and offer as much transparency as you can. Be prepared to hear things that might make you uncomfortable. Acknowledge when you don't have all the answers. This will go a long way to allay fear and distrust among your team. Be a source of positive motivation. Exude courage and let your employees know that you are prepared to address whatever changes are coming. Follow this simple communication strategy. Tell your team what you know. In uncertain times, staff members need information. Without information, it just increases anxiety and stress, neither of which is a benefit to them or the leader. Next, tell them what you don't know. Be honest. If you don't know something, tell them. Otherwise, your team will think that you are trying to withhold information, or worse, they still may hold something they know, which you don't. Next, tell them when you will know. For those things that you don't know, provide a timeline for when you think you will know. Knowing when the uncertainty will end can reduce the level of uncertainty and the associated stress levels. Finally, explain your plan. Explain why you're making the decision you're making. If they are logical, you will get buy-in. If not, you will get questions. Transparency breeds trust, and in uncertain times, trust is a great commodity to have. It's also important to remain flexible. In uncertain times, it's possible that new information will arise that will challenge our plan or present a better solution. We need to keep an open mind and not just stick to the first plan as a way of increasing certainty. We need to be flexible and able to adapt better solutions as they arise. Our goals should be to keep moving forward and at the best possible pace, not just sticking to the plan. Thinking creatively and remaining agile and adaptive to change is key. Stay strong and open-minded to finding innovative solutions to complex problems, knowing that even though methods may change, goals will remain the same. It is important to learn to master two things. One, acknowledging change. There is nothing worse than ignoring the elephant in the room. When it's obvious changes are happening, good healthcare leaders acknowledge that fact, discuss honestly, patiently, and consistently what they understand to be happening, and are as transparent as possible. During times of uncertainty, burying your head in the sand is the quickest way to breed skepticism and distrust among those who look to you for answers, direction, and leadership. Number 2, recognizing what will not change. Not everything is changing, and that's important to talk about too. Keeping your organization's vision, mission, and goals crystal clear in the minds of your employees is crucial. Remind them that even though the delivery and management of healthcare is transforming, the big picture remains the same, maintaining a patient-first mentality at all times, delivering the best, most compassionate healthcare, and embracing and implementing innovation. Confidence in the leader is crucial during times of uncertainty. Our teams may not know what the solution is, but they need to be certain that they have someone who will both define the way forward and achieve it. As leaders, we need to project confidence to help build that trust. In our times now, medical professionals are keeping their spirits up amid coronavirus chaos by doing different TikTok challenges, such as the Onana foot dance, which has become a new form of greeting for some at hospitals. Utilize online social media platforms to motivate and uplift your medical team as they survive the uncertainty and chaos during the pandemic. The battle against COVID-19 is taking a toll on the mental health of healthcare workers, according to a new study in the Journal of the American Medical Association. The study focused on Chinese healthcare workers, which concluded that those like nurses and other frontline healthcare workers have a high risk of developing unfavorable health outcomes and need support. Despite the grim situation, some healthcare workers have found ways to inject some positivity. For example, an Instagram user who's a nurse acknowledged how those in her profession can be mentally impacted by long hours treating COVID-19. She tried to bring some light-hearted into it by attempting the Flip the Switch TikTok challenge, where people record themselves dancing and switching outfits to rapper Drake's song nonstop. In conclusion, remember the Robert Louis Stevenson quote, "Keep your fears to yourself, but share your courage with others," as I think this is great advice. Identify small wins that the team can achieve quickly and easily. These quick wins need to be meaningful and celebrated, as that will help to boost confidence, increase morale, and create momentum. A culture based on small wins keeps frontline workers engaged with quality, initiative goals, and practices while building momentum for larger quality and safety improvements. Small victories, big successes. The principle is simple. Start slow and work your way up. When we think about progress, we often imagine how good it feels to achieve a long-term goal or experience a major breakthrough. These big wins are great, but they are relatively rare. The good news is that even small wins can boost inner work life tremendously. Many of the progress events reported represented only minor steps forward, yet they often evoked outsized positive reactions. Even ordinary incremental progress can increase people's engagement in the work and their happiness during the workday. Because inner work life has such a potent effect on creativity and productivity, and because small but consistent steps forward shared by many people can accumulate into excellent execution, progress events that often go unnoticed are critical to the overall performance of organizations. When you notice a little victory, you could give yourself an inner compliment, as well as share it to others using compliments like this. Hey, I or you handled that pretty well. Good decision. Way to go. You kept your cool under pressure. Little things like that. It's also important to focus on your one true mission. Stepping away from healthcare for a bit, in 1983, Steve Jobs was trying to entice John Sculley to leave a wildly successful career at PepsiCo to become Apple's new CEO. Jobs reportedly asked him, "Do you want to spend the rest of your life selling sugared water, or do you want a chance to change the world?" In making his pitch, Jobs leveraged a potent psychological force, the deep-seated human desire to do meaningful work. The question is not if your organization will experience uncertain times. The question is when. In order to be successful during times of uncertainty, your organization must be patient, it must be consistent, and it must focus on a goal that serves as your one true north. The goal of your organization, the reason you exist, and what you bring to the world should serve as a litmus test for everything that you do as you work through uncertainty. Staying true to your organization's goals helps you prioritize as you sort through the chaos surrounding you. Make sure your organization knows what its mission is. Remind your team of that goal and drive toward it. Doing so puts uncertainty in its place as an unnecessary distraction from your company's true potential. Managers can help employees see how their work is contributing. Most importantly, they can avoid actions that negate its value. Now let's talk about ethics. The punchline is there's an ethical consensus that healthcare workers have a prima facie duty to work because of everything that has been invested in them, because of their unique position where not just anybody can replace them, because society looks to them to serve this function, and also because they went into this profession and are expected to go into work. However, the obligation of healthcare workers to show up for their jobs is not absolute. If hospitals don't have personal protective equipment, they are in no position to tell their staff to show up and work. If a hospital cannot provide even a basic level of safety for their employees to do their job, then they are turning their hospital not into a place to treat patients, they are turning it into a hub to exacerbate the problem. A major epidemic or pandemic can overwhelm the capacity of outpatient facilities, emergency departments, hospitals, and intensive care units, leading to critical shortages of staff, space, and supplies with serious implications for patient outcomes. Proactive planning, in which leaders anticipate and take steps to address worst-case scenarios, is the first link in the chain to reducing morbidity, mortality, and other undesirable effects of an emerging disaster. The duty to plan ahead is worth highlighting, as failure to plan for scarce resource situations may lead to the inappropriate application of CSC, or the Principles of Crisis Standards of Care, wasted resources, inadvertent loss of life, loss of trust, and triage decisions being made unnecessarily. This will force poor choices on healthcare providers who will already be markedly limited in their ability to deliver care. Staff shortages may be the primary challenge to implementing surge capacity plans during an epidemic. COVID-19 has sickened many healthcare workers. Although it's unclear how many of these were personal protective equipment or PPE device failures versus failure to use PPE for patients with mild or atypical symptoms. Key issues to address are staff safety, so comfort with the PPE provided and the care techniques practiced, housing. Providers at risk for nosocomial acquisition of infection may request alternative housing to avoid exposing family members. On and off campus options may be needed. Information. Staff must be informed about contingency and crisis practices being implemented and the reasons for the decisions. Shift type length. Shifts should be balanced to avoid fatigue and burnout over the weeks or months of an epidemic, yet ensure appropriate staffing. Support, information, and training. Medical assistants, environmental services, transporters, and others may have equal or greater need compared to physicians, advanced practice providers, and nursing staff. Effective leaders leverage dilemmas to enhance their organization's strategy for success. They are out-of-the-box, broad-minded thinkers who are masters in the art of innovation. They embrace the unknown, finding silver linings and progressive ways to approach challenges. They are positive. According to Curtis, leaders who have a positive approach and a strong passion for their work can help organizations navigate uncertain terrain by staying true to a compelling mission, improving healthcare. He adds positive leadership can also serve to increase workforce engagement and bring everyone on board. After all, leaders do not live in a bubble. They collaborate with departments, internal and external, to find productive solutions and to challenge existing ideas. Effective leaders help their organization not only survive upheaval, but flourish in the midst of it. Thank you.